So the case, it's a 43 years old man. Colonoscopy 2 weeks ago found a lesion in the transverse column. We see the picture of the lesion. I'm not sure it's 25 millimeter LST. So the purpose today is to go to check for this lesion. We are now at 25 centimeter. I think this is the sigmoid loop. So we'll push the scope slowly. I'm using CO2, but not a lot of insufflation. I will just try to put only water. So this is the left column. اسمع خذ ماسك ونفسه بالماسك. زدته ديبريفون تو. دوك عمل بوز نفسه شويه وكاو سيتو. So this is the lesion I think they saw here. Really, it's not a huge lesion. It's a little polyp here, but I will just shake it a little bit. I don't want to lose this polyp. Maybe it's not this one because I see the right flexure here, or maybe the left one. We are at 65 centimeter. So what I will do, I will get my snare. This is a 6 millimeter on spot. So before finishing my colonoscopy and check for the lesion, I want to get this out. It's a 6 millimeter. It's a regular pit pattern, so it's a nice 2, GNet 2A. I will put it on 5 o'clock position, like this. I'll put some water. Hello. So the snare is opened. I want to get the 5 o'clock position like this. And pull back slowly my scope. I think it will be nice like this. هذا سكر بشوية 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 برقص. And the cut is done. We save margin. So we suck the lesion in the channel. We should get it now. So this is the scare. So we are sure we have a safe margin here. So now I can finish my colonoscopy. We go to the right colon and search for the lesion described before. ناحية البيجو. So we get the polyp in the polyp trap here. Now we are reaching the right colon. I think we are at the end of the transverse colon. We didn't find any lesion, but a lot of water here. And this is the right flexure. So we should reach now, we have the right colon, but we have a loop here. I see the right flexure here. So we'll suck a little bit the air to shorten the colon and then try to push. And this is, I think we are in the right colon here. It's not so clean. And this is my cecum. I'm in a long scope position. I see something here, so we have to clean all that before doing anything. And this is a lesion. It is not in the transverse colon, but it is in the cecum. Should I do my resection now with this dirty colon? نشرق ده أكتر، خلينا ننظفه شوية. I think it's less than 20 centimeter. But this is not the lesion seen in the first colonoscopy. I think we can do it saline underwater. So we'll put maximum of water now. So we have a regular pit pattern here. So first thing to do, we have to go to the short scope position compressor. رقد لي بدي رقد لي. So, so now we are at 80 centimeter. We are in the short scope position. I have to clean all my field and then decide. We see it clearly here. So the question now, we are in good position. Should we do ESD, EMR? So the only issue with the underwater EMR is that we have this left side of the lesion. I don't think we could grasp it in one piece. And you see how little is the lesion. أعطيني 20 11 20. So I will try just to catch it with the snare. And see if we can catch all the lesion with our snare. So we get out all the air in the cecum. But of course I want to clean all this. So my first idea is to catch this lesion with the snare. If it's monoblock resection, it's perfect, we will cut it. If not, we have the plan B, is to inject. So the lesion is at 5 o'clock position. You see the air locked here. So we try to get this lesion. حل بشوية 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 من تحت حتى نقول لك. So we'll just anchor here. حل بشوية. حل 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 فقط هكاك. So I think we have all the lesion. I will push my scope. أبدأ سكتة شديدة. So we get all the lesion now, I'm sure. So we will try. I think it will be. So the cut is done. So first thing to check, we don't have perforation, so it's the good news. And the second thing is the monoblock. I think it is a monoblock resection, but we will check again. So we see clearly all the margin are okay. I don't see blood vessel here. We are in the cecum. We see some bleeding here. And of course, I want to check my margin. And we see how beautiful the picture are. The margin are okay here. I see the left one okay, the right one are okay. The proximal one are okay. So I don't even think we need to coagulate the edge, but we will do it. خرج شوية. C'est bon. So we'll use forced coag. Maybe soft coag will be better. We are under saline, donc I will put it at 5. And try with the distal part. قد بدي هذه اليوم زدت لي 4 ساعة على الأقل. حضر لي كليب هونك. So it's really important to just coagulate the mucosa because we have the muscle layer just behind us. We see some blood vessel there. I don't want to coagulate anything in the muscle, so I will apply my clip now. I will check for the lesion. أعطيني 16. My polyp should be outside here. This is the air, so we'll find it maybe here. So I will put my first clip in the distal part. قلت لك فكرني باش نسجل ما فكرتنيش. So I think we will need 3 clips here. أما أطلقها باش تجيني سهل علاش هكا. حلة. دور لي شوية، دور على اليمين شوية. أقعد هكاكا. So my first clip will be in the distal part here. سكتها شوية. سكرة. هات واحدة أخرى. So we have always to focus on the closure and begin putting the first clip in the distal part, so we can push the first one with the cap and expose our second clip place, which will be here. So the first one is replaced distally. So I think even the third one won't be necessary. And we get it slowly out, hello. And this is the best position, so I will put my clip inside the cap, push the first one in the upper part, like this. I will take my and try a second. So we could put another clip, but I think it's okay. We'll wash a little bit. I don't want to move them a lot, but we can put another one between these two clips. ما تحلش حتى نقول لك. So for me it's okay. Maybe هات واحدة أخرى. One in the middle and it will be closed. And then the next step will be to extract, get out this polyp. But we have to remember that in the first report we have a lesion in the transverse column. حلة. So the first clip is there. We have to put it behind, between the two clips. We are in the cecum. Sakare. Sakare. So now we have closed everything. So أعطيني So now we have to catch our specimen. We have to found it. So the air in the upper part, we should get out this water, and we should found our lesion just here. I see it just here. And of course, we have to inspect the rest of the column. So this is the first thing to learn today is even if you have picture of lesion in the transverse column, it costs nothing to finish your coroscopy again, to check again. حلة. أبدأ سكتها. شديتها. C'est bon. شد بالكدية. So now we have our specimen there. We'll get out all this dirt water. And I will just put water to be in the immersion technique and check this right column. And see, it's not very easy to suck the all this dirty water because we have a channel with a retrieval device. So I don't think I will be able to suck anything now. So I will take my time. We are at the end of the right column, so we have here the transverse column. So we'll check again this place here. We'll do it with NBA, with TXE mode. I don't have anything until here, but we have of course to check and double check. And the other solution is to get the specimen out and go again inside and do another colonoscopy. But I think there's something here. I see something here. So this is a flat lesion. It's a sessile serrated polyp. So it's just near the right flexure. So what I will do, I will really go back out with my specimen and come back again. And of course, check, check, and check. So we have only one lesion in the just before the at the end of the transverse column. So I will go out. I think it's not important to see here because the vision is not clear with this dirty water. So I will pull slowly and gently my scope. I see some blood here. This is the scare of the cold snare polypectomy. This is the left column. And we are in the hello. Sakara. So we'll take care of the specimen later. So we go again for our colonoscopy. So left column, there is nothing here, so we go easily to the sigmoid loop here. It's at the 1 o'clock position now. I have my loop here. It's not an issue. I will go with a loop and then unloop like this. So I'm advancing slowly. I'm searching for my first polypectomy, the cold one. This is the end of the left column. This is the transverse one, and this is a lesion. I think this is the one we've seen before. راح تحط البياج pense froide. This is another lesion. So it's a 5 millimeter GNet 2A. We see the regular pit pattern there. It's a third of the cap, so 15 millimeter cap. It's 5-6 millimeter. We'll keep it at 5-6 o'clock position. هلا ابدا سكر شويه شويه قصي. So the cut is done. We'll check for the scare, and we have a full complete resection. I don't want to lose a lot of time. The piece is in channel now. I will pull back my snare, but I leave it here because I have the other lesion to cut. So I think this is the right flexure. So we'll push and with a loop, and then we will unloop. I'm pulling back my scope while trying to find the direction of the lumen, which should be in the upper part of the screen. I will put some water. I think it's here at 1 o'clock. And you see how the movement, how slowly. So this is our cecum. Our lesion, the big one, is here. There's no bleeding, nothing happened. So now we finish our exam to check for other lesion. So here we are in the beginning of the transverse column. We see the other lesion, the sessile serrated lesion was here. We should found it. So I think she's here at 6 o'clock position. She's just hiding here behind this the cap. We'll see it now. أمانك شرك الرمب. So I don't found it now until now. So I will use the immersion technique to maybe it will appear here. This is the lesion we found, the second one. And we remember it's between this one and maybe 5 centimeter. And it is here, just it is at the tip of the cap. So I'd have to focus on my screen. I know she's at the 6 o'clock position now. Hello. So I pull back slowly and try to find it. It's here. You see it clearly here. It's not a big one, but that's okay. So the lesion is cut, so we'll just take it to the polyp trap inside the channel now. We check for the scare, of course. I won't put any clips here. It's a cold snare. It will bleed a little bit, but not. So we go back now to focus on our transverse column. So now we have clean water, so we can go under water or under saline inspection. This is the scare of the cold snaring. We can check it again. We have safe margin here. So I will suck some water here and pull back slowly my scope. We are at 50 centimeter, and you see clearly we have nothing here. And this is the end of the transverse column. ايش زيدوا؟ ناحية البياجة. حضر فيكساسيون حضر. دور الاسيستون بجنبي هنا. We are now in the left column, so I will wash, inspect, check, double check, put some CO2. I don't see nothing from here. And we are now in the sigmoid loop. I have nothing. This is a snare of the cold snaring place, so we wash again. Of course, nothing to do, it will stop alone. We are out from the loop and we are now in the rectum. I think we are at 20 centimeter. This is a sigmoid and the rectum is here. So we'll check the rectum and we finish So we have always to get this picture of the rectum fully inflated. So you wait a little bit. And this is the picture we have to get at the end of any procedure. This is plastic. I don't care about it. It's less than 3 millimeter. And I don't have anything else here. So now we will go check our specimen. حطي ضوء ضوء حتى تليفون عطيني. غادي النت حط فيه. تحطه من فوق ضوء خير هكاك. مسطرة. So we get now to check with the specimen to see the full lesion. So it's a regular pit pattern. We have a clear margin here. I think on the endoscopic view, we have the clear margin here. Clean margin from here. And we see how with the water, we see clear our margin here and all around. حط مسطرة. And we have, I think, a 4 centimeter lesion. مش شوية لا العكس. هكاك قدر. So it's 30.5 centimeter. And you see how we can get it en bloc resection with only a snare. So we have to choose the safe thing oncologic purpose and safe procedure for the case. شده